Dr. Patricia Bartlette, candidate of the Nevis Reformation Party, believes the Nevis Island Administration is retiring emergency room doctors too early, leaving a gap in experience. Speaking with SKN Newsline recently, Dr. Bartlette expressed the view that the policy implemented by the Alexandra Hospital needs to be reviewed so there remains enough experienced doctors to help facilitate the effective development of younger doctors in an emergency room environment.
We must make sure that our doctors are well supervised, and I acknowledge that they are well educated, but they need the experience. And there are studies that have been put out by the National Institute of Health in the United States, as well as the National Health Services in the UK, that make the point, and I don't want to scare anybody, but it's the reality that these studies point to the fact that when we have young or novice doctors, they could be older, but they're just now in the system, who go or transition to these institutions where you have emergency situations that they have to attend to and they don't have the experience, that the level of fatalities and the clinical outcome for patients is usually not the best. We don't get the best outcomes. And all I want is the best outcome for all of us. And that is not knocking any professional, any young professional. That is just saying that there's a standard, and we ought to acknowledge the reason why there's a standard. There's a standard why in emergency rooms in the UK and the US that you have a 50-50 mix, 50 older doctors, 50 younger doctors. There's nothing wrong with that.
Dr. Bartlette said the premier selection of the clip segment of her radio discussion and presenting it out of context was mischievous and devious. Glenn Bart reporting for SKN Newsline.